Hello, good morning or good afternoon to all the judges and everyone who is watching this presentation. No matter what time is it now, I hope you're having a great day. I'm Yee Jin, a final year mechanical engineering student who's going to graduate soon. Well, if nothing goes wrong. First of all, I truly appreciate the opportunity to present you on the topic of detecting asynchrony in mechanical ventilation. I was exposed to this topic due to my final year research and was working on developing a detection algorithm with my supervisor, Dr. Chiu. So, having noticed the rising research and the increasing focus in mechanical ventilation, I thought it would be an interesting topic to share with everyone here, and I hope you will enjoy the rest of the content. As we all know, mechanical ventilation is a breathing support mechanism that is normally used in the hospital ICU. It can help the patient who develops breathing difficulties or respiratory failure to sustain their life by maintaining the breathing mechanism. Especially during this pandemic, the need of ventilators has risen to support severe COVID-19 patients, ensure them getting enough oxygen as needed while the body is fighting against the disease. Now, one of the concerns about ventilators is to ensure that the ventilation process is safe and comfortable for the patients. However, there's a lot of complications in managing the ventilation, and one of the issues is the asynchrony between the patient and the ventilator. Patient-ventilator asynchrony. As the name suggests, it is a condition when the ventilator support does not match with the patient's demand, normally caused by non-optimal setting of the ventilator. In fact, asynchrony is a very common situation among patients. According to research, the occurrence of asynchrony can reach up to 80% among the patients under non-invasive ventilation. If we look at this figure, imagine when the ventilator is trying to supply the air to the patient, but the patient himself is trying to push the air out. Well, fighting is always not a good option, and as a result, someone will get hurt. Since the patient is actively fighting against the ventilator's work, in a severe case, it can cause our lung muscles to be injured. Certainly, mechanical ventilation is meant to support the patient when they recover from the disease, and any negative effects is definitely not the desired condition. It means that asynchrony should be detected on time to allow the clinicians to select a better ventilation strategy for the patient. So, in my following presentation, I'll share about how detection of asynchrony can be carried out, and in the mechanical engineering point of view, how do the engineers help in solving this problem? I'll cover the relationship between breathing mechanism in human and the ventilator, and how does it relate to asynchrony detection, how mechanical ventilation is carried out, and how do we recognize when an asynchrony happens. I'll briefly talk about the overview of current asynchrony detection approaches, a review of one of the methods, which is the ASCE-DRS model. Finally, I will express some opinion of the future improvement in this field and what can we do to make it better. How do we breathe? Well, I'm sure everyone here knows how to breathe, but there's one important concept that I want to point out, is that when we breathe in, the contraction of our lung muscles actually generates negative pressure to pull the air into the lung. This is a bit different to how common ventilation is carried out. During mechanical ventilation, positive pressure is usually supplied during the inspiration phase, which means the air is being pushed into the lung. So, this difference between the patient and ventilator breathing mechanism partly contributes to the formation of asynchrony, which is why asynchrony happens more frequently when the patient is actively breathing. So the interaction between the patient and ventilator becomes important. Depends on the patient condition, different types of ventilation strategies will be selected. Besides having an invasive or non-invasive type of ventilation, it can be controlled by different parameters. Ventilation parameters, such as controlling the amount of flow and the timing of delivery, this depends on the respiratory demand of each patient. And since different patient has different demand, and during the process of recovery, the demand will also change. When the set parameters does not match to the patient, asynchrony will occur. Hence, an effective detection method is important to recognize the occurrence of asynchrony in real time, so the ventilation can be adjusted to optimal. Now that we know how PVA can form, but how do we know when it happens? How do we recognize it? If you realize the ventilator displays different waveforms on the monitor, it is the real-time measurement of the airway pressure, flow, and volume waveforms, which helps the clinicians to monitor the patient-ventilator interactions. Under the optimal condition, the waveform should be consistent over the time. But when asynchrony occurs, as you can see from these figures, there will be some sudden change in the waveforms. It can occur anytime during a cycle, and depends on the situations, the characteristics of waveforms will also be different. To detect these asynchronies, of course, the easiest way is to observe the waveforms. And currently, manual detection is still the most common approach to monitor the asynchronies by the bedside. But there are so many types of asynchronies available, and some of them are not that obvious to recognize. Well, additional signals are available to increase the accuracy of detection, such as measuring the electrical signals of diaphragm, but it requires the installation of special instruments. Moreover, we can't afford to manually monitor them 24 hours by the bed. What if there are lots of patients in the ICU? Manpower is essential in a clinical environment. This leads to the rising research in automated algorithms, which make work much easier and less demanding. Overall, automated algorithm has two main branches, rule-based algorithms and artificial intelligence. Rule-based algorithms, as the name suggests, it is done by setting a few rules to filter the waveforms. If certain rules are satisfied, we can recognize it as an asynchrony, and if not, it is a normal breath. Another approach is using artificial intelligence, which is a powerful tool in learning from the data. For example, CNN, which is capable of learning from the patterns based on the data provided, without anyone telling the computer what are the desired patterns and where are the patterns it should look into. Now, we're not going to compare which method is better here. Of course, each of them has their pros and cons, as well as their own limitations. But instead, I'll review one of the rule-based approach which I am familiar with, and it offers an interesting view of using the lung mechanics in asynchrony detection. Just to clarify, it doesn't necessary for the method to be better than other approaches, and I strongly encourage you to look for the others if you're interested. First, let's look into this single lung compartment model. Think of it as an equation to describe the motion of the lung during a breathing cycle. So how much pressure do we need to supply to open up the lung and bring air in? As the air flows to the tubings, the airway, certainly there must be some resistance that opposes to the flow. And when the lung volume is enlarged, the muscles of the chest wall needs to be stretched. What is the elasticity of the lung to be able to stretch it? It is pretty much like a balloon. When we fill air in, it will be stretched open and enlarged in volume. And when we let it go, the balloon is relaxed and the air will be released. The single lung compartment model is to describe the motion. And if you look at the equation here, the parameters P, Q, and V are the pressure, flow, and volume respectively, which we already have the information from the ventilator. R and E are the resistance and elastance respectively. P0 is the peak. You can think of it as the pressure of the system environment. With that, the ventilator waveforms are actually the graphical representation of this motion, which essentially is a result of lung mechanics. Based on that, the equation can be altered to this, which involves the concept of time-varying elastance. So the time-varying elastance EDRS, in simple words, is essentially a parameter to describe the change in lung elastance when the patient is spontaneously breathing. The figure on the left shows that for each breathing cycle, an EDRS waveform can be plotted. So each breathing cycle will have a unique EDRS waveform. And after that, This method by Poole and her colleagues find the area under curve of EBRS for each breathing cycle and set the upper bound and lower bound of the threshold as plus minus 50% of the mean. If you look into the ones with red circles, they are the asynchronous breath, which exceeded the threshold. So this method demonstrates the feasibility of using time-varying elastance to detect asynchrony. And this parameter is able to differentiate between a normal breath and an asynchronous breath. It is important that when we develop a detection model, besides focusing on the patterns of waveforms, we have to analyze the mechanics behind the asynchronous breath. What are the actual reasons that causes the asynchrony? This concept is useful, especially when the asynchrony does not demonstrate an obvious characteristics through the waveform. Having researched in this topic for 1 year time, I truly hope that a reliable and robust method can be generated and validated in a clinical environment. I believe it will benefit both the clinicians and the patient by providing a safe ventilation to them without requiring so much effort in monitoring. Besides, since IoT, the Internet of Things, has been increasingly popular nowadays, I believe introducing the connectivity of the ventilator to the system will strongly enhance the efficiency in managing ventilation. To better visualize this, I will demonstrate the remaining points in my next slide. We have so many ventilators in the hospital, and depends on the situation, there could be lots of ventilators running at the same time. I'm sure it will be very demanding in manpower. However, if all the patients can be monitored at a glance, it will be a different story. Patients are connected to ventilators and lots of data are being generated. So we could connect all these ventilators to a centralized system. And so this data could be analyzed via the algorithms that we have developed, and statistics on the detection outcome will be fed back to the clinician so that an optimal ventilation setting could be adjusted. One step further from this, prediction of future occurrence of asynchrony could be made based on the previous statistics. And with the embedded clinical guidelines in the system, it could feed back to the clinicians on the recommended settings to ease their work and decision process. Characteristic data can be stored, either hardware or cloud storage, and it could be retrieved anytime for the clinicians to review on the patient condition. With this cycle, it fulfills the requirement of generating an efficient detection system, and at the same time, greatly reduce the clinician's work. Well, of course, in a clinical environment, things are not so straightforward, and there are lots of validation works to be done to ensure every step is reliable to be implemented. But with the technology advancing, we have no reason to believe this is not possible. The important thing is to take one step at a time and slowly reaching our goal. As a summary of the above, I've covered the importance of asynchrony detection, how asynchrony can form, and why do we need to detect it, the need of automated algorithm in asynchrony detection, and there's two main branches of research, rule-based algorithm and artificial intelligence. I've also expressed my opinion in the possible improvement in this field. Overall, the key point is to provide a safe and reliable ventilation in an effective manner. With this, I'll end my presentation. Thank you for listening, and I hope you find it interesting.